Good morning. We're going to get started. I know we have others coming. Weather may be affecting some of that travel, but we're going to get underway. I'm Dave Kindig, Emeritus Professor of Population Health Sciences at the University of Wisconsin and co-chair of the IOM Roundtable on Population Health Improvement, along with my co-chair, George Isham from Health Partners in Minnesota, who you'll be hearing from at the end of the day, sort of as a rapporteur on our session. I'm really pleased to welcome you to today's workshop, those who are here, Roundtable members, those who are here, and also those who are on the webcast, because it is being webcast as well, and we welcome those of you also. So this is our first full formal meeting of this roundtable. But a few months ago, we had an organizing meeting here, and we heard several compelling challenges about the state of our population's health from IOM President Dr. Harvey Feinberg and several other distinguished presenters. And they pointed out our unacceptable performance in health outcomes in relation to other countries. They pointed out the unacceptable and persisting disparities over time in this country. And they actually touched on the inefficiencies in our healthcare system that could provide a health dividend, potentially, to sort of possibly redirect some resources to these efforts and challenges that we're facing. I encourage those of you who were not at that meeting or those listening on the website to actually go to our website, because you can download and refresh yourselves on those really very compelling presentations that we made. So roundtables are a little different than the usual IOM consensus process, but these are venues where leaders from public and private sectors meet together over a long period of time. In our case, our sponsors have generously provided resources for 3 years, to begin this work. And we'll meet and discuss leverage points and opportunities arising from changes in the social and political environment that will help us improve population health, which is sort of a big order. Now, we don't have a formal vision yet for this activity. Our roundtable members will be meeting tomorrow in closed session to sort of finalize what you'll see on our website later in the coming month. But I suspect that you'll find within that some ideas that we would really like to see a transformed, multi-sectoral health system that has continuous and accelerated improvement in our life expectancy, in our quality of life, in disparity reduction. Roundtable members have already urged upon George and I and our whole group that the urgency of this situation, that we've really waited too long to get serious about making these improvements. And maybe it's possibly too bold, but the possibility that we could sort of, that we might be able to catalyze some sort of a national dialogue or a movement towards moving this situation along. So that's at least some of our early aspirations about what we're about. The Roundtable has a variety of activities that it can engage in to move that along. Workshops like these, collaboratives with stakeholders, discussion paper series, whatever. Those are the things that we'll be planning in the coming months. And we'll be talking about the list of workshops like this that we'll be carrying out in the future, align with those sort of challenges. But it was early on, even in our very organizing phone call, that sort of dealing with the issues that the Affordable Care Act sort of presents for population health improvement was so relevant and timely and ongoing that that's what we should decided to begin with, and that's why we're here today for this workshop. So we'll feature presentations and panel discussion on highlighting some models that are out there now for integrating personal health care and population health improvement, and some opportunities for improving through innovations in different areas of the system. You don't pull off a roundtable or a meeting like this without help from a lot of staff, and I really want to thank IOM staff, Alina Bachu, Colin Firth, Lyle Hernandez, and Rose Martinez, who's the director of the Board on Public and Population Health, for helping us bring this day off. And the only other thing I want to do before I introduce George Flores is to just say that at the end of the day, George Isham, my co-chair, will be chairing a discussion session, a rapporteur session on sort of what we heard today. And we would like to challenge and request that our roundtable members specifically sort of keep notes during this discussion today, because at the end of the day, he will be calling on the members for sure to sort of come forth with some of the most salient features and points that they heard during the day, sort of as a pulling the discussion together activity, as well as kind of laying the ground for future work and where we'll go. So please keep your pencil out and make note of those things. So roundtables are quite member-driven in terms of our agenda and how we organize. And so for every workshop, we have a planning committee that is chaired by one of our workshop members and consists of other roundtable members, as well as members from outside the roundtable. So we were really pleased that George Flores stepped up to chair the planning committee and to be our host for today. George is a physician and an MPH. He's a senior program officer at the California Endowment. He's done a lot of work on obesity prevention and a lot of the broad sort of community health improvement activities that endowment is providing leadership on. Been a health officer in San Diego County, worked on several IOM committees, such as obesity and the future of the public health. So I'm going to turn it over to George to set up today, and then we'll move into the first panel. Thank you.